Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Let us begin with a clear idea. Zinc is not a back pain painkiller. Do not treat it like ibuprofen. Do not expect it to numb the spine in 1 hour. Think of zinc differently. Think of it as a small mineral that helps the body run the repair, immune, and inflammatory systems that decide whether injured tissue calms down or stays irritated. Why does that matter for back pain? Because much back pain is not only a mechanical story of bones, discs, and muscles, it is also a biochemical story of inflammation, tissue turnover, nerve sensitivity, and recovery capacity. The World Health Organization reports that low back pain is the leading cause of disability worldwide, affected about 619 million people in 2020, and is projected to affect 843 million people by 2050. Most cases are classified as non-specific, meaning no single clear structural cause explains the pain. Now ask this, why can two people have similar MRI findings, yet one walks normally and the other cannot bend to put on shoes? Why can one disc bulge stay quiet while another becomes a constant alarm? Look beyond the scan, look at the environment around the tissue, look at inflammatory signals, look at healing resources. Look at whether the body has the raw materials to repair collagen, regulate immune cells, and keep oxidative stress under control. Zinc enters this conversation because it is required for hundreds of enzymes and is involved in immune function, protein synthesis, DNA synthesis, wound healing, cell signaling, and tissue growth. So, listen carefully. Use zinc as a support strategy, not as a standalone cure. Use it intelligently. Ask, why would my back need zinc? Then ask, how would zinc actually help? If the answer is only because supplements are good, reject that answer. We need a better answer. The better answer is this. Zinc may help back pain when the pain is being sustained by poor tissue repair, excessive inflammatory tone, impaired immune balance, or a zinc intake that is too low for the body's demands. First, understand the inflammation link. Do not imagine chronic back pain as merely a sore hinge. In many people, the painful spine behaves more like a heated conversation between discs, muscles, immune cells, and nerves. In a clinical study of patients with chronic low back pain due to herniated disc, researchers found higher blood levels of TNF-alpha and IL-6 compared with healthy controls. Why is that important? Because TNF-alpha and IL-6 are not just laboratory names. They are signaling molecules that can amplify inflammation and increase pain sensitivity. How can zinc fit into that picture? Zinc helps regulate immune responses. A systematic review and meta-analysis of randomized controlled trials reported that zinc supplementation can reduce IL-6 levels, and that dose and form influence the effect on inflammatory markers. Do not overstate this. This does not prove that zinc cures back pain, but do not ignore it either. If IL-6 is part of the inflammatory language of some back pain, and zinc can influence IL-6 in human trials, then zinc becomes a biologically plausible support tool, especially when deficiency or low intake is present. Now go deeper. Ask, how does a tiny mineral influence a painful back? Start with repair. Your back is made of tissues that constantly remodel. Muscle fibers, fascia, ligaments, vertebral bone, joint capsules, and intervertebral discs. These tissues require proteins, enzymes, and controlled inflammation. Zinc is involved in cell proliferation, membrane repair, antioxidant defense, immune activity, extracellular matrix regulation, and wound healing. In wound healing literature, zinc is described as participating across the phases of repair: inflammation, tissue formation, matrix remodeling, and scar regulation. Why does this matter for the back? Because a strained lumbar muscle, irritated ligament, overloaded facet joint, or recovering disc environment still needs organized repair. Do this mental exercise. Imagine inflammation as fire. Too little fire and repair never starts. Too much fire, and the tissue stays irritated. The goal is not to erase inflammation, the goal is to resolve it. Zinc appears to help the immune system move with more order. It supports immune cells, antioxidant systems, and tissue rebuilding. That is why zinc deficiency is associated with delayed wound healing and impaired immune function. In older adults, zinc deficiency can delay wound healing, and people with gastrointestinal disorders, bariatric surgery, vegetarian or vegan diets, pregnancy, lactation, or alcohol use disorder may be at greater risk for inadequate zinc status. Now ask, what does this mean for someone with back pain tomorrow morning? It means you should stop thinking only about the painful spot and start checking the recovery system. Look at the whole pattern. Is the person healing slowly from small injuries? Are there frequent infections, poor appetite, hair shedding, skin issues, low protein intake, heavy alcohol intake, long-term digestive problems? A mostly plant-based diet with lots of grains and legumes but little attention to mineral absorption? If yes, consider zinc status as part of the assessment. Do not self-diagnose. Bring it into a clinical conversation. Next, consider the disc itself. The intervertebral disc is not just a cushion, it is living tissue with cells that respond to inflammation, stress, and nutrient conditions. A 2025 study on intervertebral disc degeneration examined ZIP8, a zinc transporter, and found that ZIP8 affected inflammatory cytokine production, NF-kB activation, extracellular matrix degradation, macrophage polarization, and disc degeneration in experimental models. How should we interpret that? Carefully. It does not mean swallowing zinc tablets directly repairs discs, but it does show that zinc movement inside cells is woven into disc inflammation and degeneration pathways. That detail matters. Why? Because it shifts the conversation from zinc is just for colds to zinc biology is active in musculoskeletal tissues and inflammatory signaling. The back is not separate from the rest of metabolism. The spine reads the body's chemical environment. If the environment is deficient, inflamed, poorly nourished, or oxidatively stressed, the back may have less capacity to settle. Now move to bone and structural support. The lumbar spine depends on vertebral strength, muscle control, and connective tissue integrity. Zinc has roles in bone metabolism, and research has linked zinc to bone mineral density and bone formation markers. In a randomized placebo-controlled trial involving young patients with thalassemia and low bone mass, 25 milligrams of zinc daily led to greater gains in total body bone mass than placebo over 18 months. A systematic review on zinc and bone-related outcomes also reported relationships between zinc status, intake, supplementation, and bone mineral density, including lumbar spine outcomes. Again, do not exaggerate. This does not make zinc a direct treatment for ordinary mechanical back pain, but it supports the idea that zinc is relevant to the skeletal system that carries the back every day. Now let us make this practical. Follow a simple sequence. First, rule out danger. Do not use zinc to cover up red flags. If back pain comes with fever, unexplained weight loss, cancer history, major trauma, loss of bladder or bowel control, numbness in the saddle area, progressive leg weakness, or severe night pain, seek urgent medical evaluation. Do not negotiate with red flags. Act. Second, keep the foundation. Move appropriately. Walk if walking helps. Use heat for muscular guarding when appropriate. Strengthen gradually. Improve sleep. Address stress. Get professional guidance if pain persists or radiates. Clinical guidelines for low back pain generally emphasize non-invasive care such as activity, exercise-based approaches, and selected non-drug therapies, with medications used thoughtfully when needed. Zinc belongs beside these foundations, not above them. Third, assess intake. Do not start with a megadose. Start with food. Choose zinc-rich foods. Oysters contain very high amounts. Beef, crab, other seafood, dairy, eggs, beans, nuts, and whole grains can contribute. But remember this, zinc from plant foods may be less available because phytates in legumes and whole grains bind minerals. How do you improve that? soak beans, use fermented foods. Combine plant and animal sources if your diet allows. Plan meals instead of guessing. Fourth, consider testing and context. Serum zinc is not perfect, but it can be useful when combined with diet history, symptoms, inflammation status, and risk factors. Ask your clinician about zinc, copper, complete blood count, ferritin, vitamin D, B12, magnesium, inflammatory markers, and other tests when the clinical picture supports them. Why include copper? Because zinc and copper are connected. Too much zinc for too long can reduce copper absorption, and copper deficiency can create neurologic and blood problems. Fifth, if supplementation is appropriate, use adult-level caution. The recommended dietary allowance for zinc is 11 mg daily for adult men and 8 mg daily for adult women. Needs rise during pregnancy and lactation. The adult tolerable upper intake level is 40 mg daily from food and supplements combined, unless a clinician is supervising treatment. Doses of 50 mg or more over weeks can interfere with copper absorption and may reduce immune function or affect HDL cholesterol. Take that seriously. More is not smarter. More can become the new problem. How should someone take it if advised? Take zinc with food if it causes nausea. Do not take it at the same time as high-dose iron, because iron at 25 mg or more can reduce zinc absorption. Separate zinc from certain antibiotics and penicillamine as directed by a clinician, because interactions matter. Read the label for elemental zinc, not just the compound name. Zinc gluconate, zinc citrate, zinc sulfate, and zinc acetate are different forms, but the key number is elemental zinc. Now ask the central question again. Why can zinc be beneficial and effective for back pain? Because in the right person, it may support 4 systems at once. 1. Inflammatory balance. Zinc can influence cytokine patterns, including IL-6, and some back pain states involve inflammatory mediators. 2. Tissue repair. Zinc supports protein synthesis, cellular repair, immune coordination, and matrix remodeling. 3. Skeletal health. Zinc participates in bone metabolism and has clinical evidence in selected populations with low bone mass. 4. Recovery capacity. If a person is low in zinc, the body may be trying to repair tissue with missing tools. But how do you know it is the right person? Look for the pattern. Low dietary intake, digestive disease, bariatric surgery, heavy alcohol intake, plant-heavy diet without mineral planning, slow healing, frequent infections, low appetite. Confirm when possible, then correct thoughtfully. Let us be honest, if your back pain is caused by a fracture, infection, cancer, severe nerve compression, kidney disease, inflammatory arthritis, or major instability, zinc is not the primary answer. Get diagnosed. If your back pain is driven by poor posture, weak hips, prolonged sitting, sleep debt, stress, and deconditioning, zinc alone will not replace movement and rehabilitation. But if your recovery system is undernourished, zinc may help create better conditions for healing. So, take this message with precision. Do not worship zinc and do not dismiss it. Respect it. Use it as a targeted support for the biology beneath back pain. Ask, why is my back not calming down? Ask, how is my body repairing tissue? Ask, do I have enough of the mineral needed for immune control, protein synthesis, collagen-related repair, and inflammatory resolution? Start with safety. Build the foundation. Improve food quality. Test when appropriate. Supplement only with discipline. Stay below unsafe long-term doses unless supervised. Pair zinc with movement, sleep, protein, hydration, stress control, and medical evaluation when symptoms demand it. Back pain often feels like a local problem, but healing is a whole body project. Treat the spine with respect, treat the chemistry with intelligence, and treat the person as a complete system. Thank you for being here with me today. Take care of yourself, take care of each other, and I'll see you in the next topic, like family, moving forward together.